Hi, I'm Ragini.
Hi, I'm Cindy,
We are psychology students.
and today we are going to do a research about the topic abnormal psychology for the group assignment. Abnormal psychology is a branch of a psychology that studies abnormal thoughts, the emotions, and the behaviors, and apply the application of the psychology science to understand and treat the psychology disorders.
A psychological disorder is any pattern of behavior that causes people significant distress, causes them to harm themselves or others, or harms their ability to function in daily life.
There are four ways to define abnormality, including statistical infrequency, failure to function adequately, device from the item mental health, and violation of the social norms. Statistical infrequency is one of the ways to define normal and abnormal. Behavior that occurs frequently will be regarded as normal, while the behavior that is rare will be abnormal. If a person traits thinking behavior is rare and statistically not unusual, he or she will be classified as abnormal. A person's behavior that does not fit into the society or function normally can also be labeled as abnormal. This kind of behavior is termed maladaptive, meaning that the person finds it hard to adapt to the demands of the day-to-day living.
Abnormality can be defined as a deviation from ideal mental health. This means that psychologists define what is normal ideal mental health rather than defining what is abnormal, and anything that deviates from this considered as abnormal. Another way to define abnormality is to see it as something that goes against the society's stance or norms in which individual lives. A person thinking and behavior classified from abnormal if it violates unwritten rules in which a particular social group expected or acceptable behavior. And the purpose of this study is to understand the abnormal psychology, to study the symptoms, causes, diagnosis, and treatment of psychological disorders, and also to study the importance of abnormal psychology. Schizophrenia is a chronic mental disorder that affects how a person thinks, behaves, and feels. It may seem like they lost touch in reality. And there are two types symptoms in schizophrenia, which is positive symptoms and negative. Positive symptoms are psychotic behaviors not generally seen in healthy people. Negative are associated with disruption to normal. There are some symptoms in positive and negatives. Examples are in positive is delusions, hallucinations, and disorganized speech. In negative, flattened affect, reduced speech, and lack of initiative. The precise cause of schizophrenia is unknown. Certain factors seem to increase the risk of developing or triggering schizophrenia, including having a family history of schizophrenia, the age of father, taking mild entering, some pregnancy and birth complications such as malnutrition or exposure to toxics and viruses that may impact brain development. The diagnosis of schizophrenia. The first step is to see a primary care of doctor or psychiatrist. Tell them what you have noticed, the steps you should take, especially if the person isn't interested in getting help. The first thing the doctor will do is psychological evaluation or a complete medical exam. They will want to know about the family, the backgrounds, whether they got schizophrenia or if they have affected by schizophrenia, how the person behaving in lately, and the doctor will take MRI scan and computer tomography. There are some treatments for schizophrenia. Schizophrenia treatment will center on managing the person's symptoms. To do that, they will probably need to take medication for an open-minded period, possibly even for psychotherapy, a kind of talk therapy. There are some types of psychotherapy such as individual psychotherapy, cognitive behavior psychotherapy, cognitive enhancement therapy, electroconvulsive therapy. There are some interesting facts of schizophrenia. Many psychiatric drugs act on the receptor of transporters of certain neurotransmitter in the brain. However, there is a great need for alternative and research looking at the targets along the brain metabolic pathways. Lack of glycogen contributes to brain pathology in schizophrenia, and new research from the Riken Center of Brain Science (CBS) shows that betaine supplementation can counteract psychiatric symptoms.
Eating disorders are serious illness related to irregular eating behaviors and severe distress or concern about food, weight, and shape. Eating disorders usually develop among teenagers and young adults. However, they may develop during any stages in life. The most common types of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. The patient with anorexia nervosa are fear of gaining weight intensely, refuse to maintain a healthy body weight, and has a distorted perception of body image. They always view themselves overweight. Bulimia nervosa is characterized by repeated binge eating followed by behaviors that compensate for the overeating, such as forced vomiting, excessive exercise, or extreme use of laxatives or diuretics. People suffer from binge eating disorder are different from bulimia nervosa patients. They do not have the compensatory behavior. Due to this, people with binge eating disorder may be obese or have a higher risk in developing cardiovascular disease. The signs and symptoms of eating disorders are chronic dieting despite being clearly underweight, obsession with calories and fat contents of food, and shifts between periods of overeating and fasting. The exact cause of eating disorders is still unknown. However, it's generally believed that a combination of biological, psychological, and/or environmental abnormalities contribute to the development of these illnesses. Biological factors, such as changes in the brain chemicals, may play a role in the eating disorders. People with eating disorders may have a psychological and emotional problems. The treatment for eating disorders is different forms of psychotherapy, such as individual, family, or group. Psychotherapy can help the patients to address and heal from the traumatic life events and learn the proper ways for expressing the emotions, communicating, and maintaining the healthy relationships. Some medications may also be effective in helping resolve mood or anxiety symptoms that can occur with an eating disorder or in reducing the binge eating and purging behaviors. The interesting fact about eating disorders is, according to the National Eating Disorders Association, people who are lesbian, gay, bisexual, and transgender LGBT are at a higher risk of developing the eating disorders.
And now is about depression. Depression is a mood of disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression, it affects how we feel, think, and behave, can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as life isn't worth living. Symptoms of depression is feelings of sadness, tearfulness, emptiness, hopelessness, angry outbursts, irritability or frustration even over small things, loss of interest or pleasure in most of all normal activities such as sex, hobbies, and sports. And also, there's a symptoms in sleep disturbances, including insomnia or sleeping too much. Abuse may cause depression. Past physical and sexual or emotional abuse can increase the vulnerability to clinical depression later in life. Certain medications, some drugs such as isotretinoin used to treat AIM, the antiviral drug interferon alpha, can increase your risk of depression, even conflict. Depression in someone who has the biological vulnerability to develop depression may result from personal conflicts, dispute with family members and friends. To diagnose depression, your healthcare will ask you questions about your symptoms and family history. You may be asked to fill out a questionnaire about your symptoms. As treatments, cognitive behavioral therapy might be used to treat depression. How this approach works and what to expect in sessions. Psychotherapy or talk therapy. is an effective treatment for clinical depression. On its own, it may be not enough to self-serve depression, but it can play an important role when used with other treatments. Psychodynamic therapy is designed to help patients explore the full range of their emotions, including feelings they may not be aware of. As interesting facts, scientific research from Science Daily was published this year in the journal Arthritis and Rheumatism. These scientific findings suggest that women who are depressed are also losing their sense of smell and may overcompensate by using more perfume.
Obsessive-compulsive disorder (OCD) is a common, chronic, and long-lasting disorder in which interrupting thoughts that occurs again and again and are followed by some repetitive, ritualistic behavior. The compulsions are meant to lower the anxiety caused by the thought. People with OCD may have the symptoms of obsessions, compulsions, or both. These symptoms can interfere with all aspects of life, such as work, school, and personal relationships. Obsessions are repeated thoughts, urges, or mental images that cause the anxiety. The common symptoms include fears of germs or contaminations and having things symmetrical or in a perfect order. Compulsions are the repetitive behaviors that a person with OCD feels the urge to do in response to an obsessive thought. The common compulsions include excessive cleaning and or hand washing, ordering and arranging things in a precise way, repeatedly checking on things, such as repeatedly checking to see if the door is locked and the oven is off. The causes of OCD are unknown, but the risk factors include genetics. Twin and family studies have shown that people with the first-degree relative, such as a parent, sibling, or a child who have OCD, have a higher risk for developing OCD themselves. Another risk factors of the OCD is the brain structure and functioning. The imaging studies have shown the difference in the frontal cortex and the subconscious structures of the brain in the patients with the OCD. There appears to be a connection between the OCD symptoms and the abnormalities in the certain areas of the brain. Environment is also the risk factors that cause OCD. People who have experienced abuse, such as physical or sexual in their childhood, or other trauma are at an increased risk for developing OCD. One of the treatments for OCD is medication. Serotonin reuptake inhibitors and selective serotonin reuptake inhibitors are used to help reduce the OCD symptoms. Examples of the medications include clomipramine and several newer selective serotonin reuptake inhibitors, which include fluoxetine, fluvoxamine, and sertraline. Psychotherapy is also another effective treatment for adults and children with the OCD. Cognitive behavior therapy (CBT) and habit reversal training can be as effective as medication for many individuals with OCD. The interesting facts about OCD is in 1980s, a man with severe OCD symptoms shot himself in the head in an attempt to commit suicide. Instead of killing himself, the bullet destroyed the part of his brain that was responsible for the OCD, and his phobia of germs and obsession for hand washing was cured. After that, he went to become a straight-A college student 5 years later.
And now is about attention deficit hyperactive disorder, ADHD. A person with ADHD has differences in between brain development and brain activity that affect attention, the ability to sit still, and self-control. What are the signs of ADHD? All kids struggle at times to pay attention, listen, and follow directions, sit still, or wait their turn. But for kids with ADHD, the struggles are harder and happen more often. There are three categories in ADHD. Inattentive. Kids who are inattentive, easily distracted, have trouble focusing their attention, concentrating, and staying on a task. Hyperactive kids are who hyperactive at frigidly, restlessly, and easily bored. They may have trouble sitting still or staying quiet when needed. Impulsive kids who are impulsive act too quickly before thinking. They often interrupt, might push or grab, and find it harder to wait. It's not clear what causes the brain difference of ADHD. There's strong evidence that ADHD is mostly inherited. Many kids who have ADHD have a parent or relative with it. If you think your child has ADHD, make an appointment with child's doctor. To diagnose ADHD, doctors start by asking about child's health, behavior, and activity. They talk with parents and kids about the things they have noticed. Your doctor might ask you to complete checklists about the child's behavior and might ask you to give your child's teacher a checklist too. There are also have some treatment for ADHD. Medicine. This activates the brain's ability to pay attention, slow down, and use more self-control. Behavior therapy. Therapists can help kids to develop the social and emotional planning skills that are lagging with ADHD. There is an interesting fact about ADHD. 6.4 million American children ages 4 to 17 have been diagnosed with ADHD.
Bipolar disorder is known as manic depressive illness. It is characterized by shifting in mood as well as changing in activity, energy levels, and the ability to carry out day-to-day tasks. People with bipolar disorder suffer from the severe mood swings that go all the way from a severe depression to the manic episodes. In many respects, mania is the opposite of the depression. In depression, people are inactive and inhibited. In mania, they are constantly active and uninhibited. The exact cause of the bipolar disorder is unknown, but several factors may be involved, such as biological difference and genetics. People with bipolar disorder appear to have a physical changes in their brains. Genetics. The bipolar disorder is more common in the people who have a first-degree relatives with the condition. To determine if you have a bipolar disorder, the evaluation may include psychiatric assessment, mood charting, and criteria for the bipolar disorder. The psychiatric assessment. The patient may fill out a psychiatric self-assessment or a questionnaire. And for mood charting, you may be asked to keep a daily record on your moods, sleep patterns. Your psychiatrist may compare your symptoms with the criteria of the bipolar disorder in the DSM-5. The primary treatments for the bipolar disorder include medications and psychotherapy to control the symptoms. The medications may include mood stabilizers, antipsychotics, antidepressants, and anti-anxiety medications. Psychotherapy is also another important part for the bipolar disorder treatment and can be provided in individual, family, or group settings. The therapy is cognitive behavioral therapy (CBT). The focus is identifying the unhealthy negative beliefs and behaviors and replacing them with a healthy positive ones. Electroconvulsive therapy (ECT) is also another therapy to treat bipolar disorder. During electroconvulsive therapy (ECT), electric currents are passed through the brain, intentionally triggering a brief seizure. ECT seems to cause a change in the brain chemistry and that can reverse the symptoms of certain mental illnesses. The interesting facts about the bipolar disorder is, according to the study published by the Medical Journal of the American Academy of Neurology, people who have a bipolar disorder may be more likely to later develop the Parkinson's disease than the people who do not have the bipolar disorder. In the conclusion, abnormal psychology is an important part of the psychology because it is useful in helping the people who are suffering from the mental disorders. From this topic, we understand the abnormal psychology better. We know how to differentiate between the abnormal and the normal.
We also learn the knowledge of the symptoms and causes of psychological disorders. This may help us to diagnose and treat the psychological disorders.
So,
Thank you.